This is the first installment of the Ask a Vet question that you guys submitted some great questions to me. I'd like to answer all of them, but I decided for the first one especially to choose a question that is pertinent to a lot of my clients that I see, and that's behavioral changes as dogs age. And so this is Monster.
We were looking to adopt a Havanese. The vet in Northern California had been given this dog and told that it was a stray. Our suspicions are he wasn't a stray. There are a lot of not great breeders in that area. He had luxating patellas, and the vet had looked for 2 months trying to find his supposed owners. Well, nobody came for a 5-month-old Havanese puppy. So we drove up and got him. We'd had him for a couple months, found out he also had a broken spine very early on, which is why he doesn't have the traditional Havanese tail. But he's sweet, smart, way too smart.
He's 15 years old?
He'll be 15 in January. Yeah.
He's a Canine good citizen. He goes to
Canine good citizen, therapy dog. He's got 400 hours in the chemo ward at UC Irvine.
What a good man.
We did abused women's shelters, the VA, hospice care. Smart. He doesn't really like to be held, but when his vest is on and he knows he's working, he will let me hand him off to chemo patients, and he'll sit with them. But he's limping really badly. He's got all kinds of growths now. He's also started this thing, he won't sleep through the night, begging for treats. He was never food obsessed before.
And now he's food obsessed?
Food obsessed. He seems disoriented sometimes.
Like staring in the distance?
Well, I'll call him and he goes the opposite direction. And he's really well trained. I'll take him out in the morning a couple of times, and he'll come in and have a bowel movement in the house.
So he hasn't been responding to calls consistently?
No.
Yeah, he might be having some hearing loss for sure.
Interesting.
There's no audiology test, but I snap and normally they'll at least look a little.
You're right.
Yeah, he's not responding. Is that?
I never thought about the hearing loss.
The same thing happened with my dog. She started eating poop when she was old in the yard, and I would be out there screaming at her, "Zodi, stop doing that." And I realized she was deaf. I didn't even realize it. You know, these changes in their senses, whether it's a decrease in sight or a decrease in hearing, play a role in their mental changes, as they age. So there's a bunch of things going on.
Okay.
And, he has arthritis. He has some kind of exacerbation of that in his right shoulder. That's uncomfortable. He has these behavioral changes as well as an increased appetite, increased panting. And the trick in managing issues that he's dealing with is we need to determine if this is a behavioral issue, a medical issue, or some kind of combination of them, which it often is. But we need to rule out medical issues first at night. If we've ruled out metabolic issues and if we're adequately treating his comfort and he's still having these nighttime restlessness issues and kind of behavioral issues where he's coming in and eliminating and staring off into the distance or seeming lost in the house, then we start to worry about something called canine cognitive disorder, where it's like aging changes, like the equivalent of Alzheimer's for dogs.
Right.
There's no 100% surefire treatment for it, but there are things we can do to support his brain and help out with the clinical signs of this issue. But the first thing I always do is, we need to do full blood work. We need to rule out medical issues that can be playing a role.
Right.
And then setting up your house to avoid injuries. And resting him when he's having acute pain. We need to give him the opportunity to heal to see if he will.
I want to find out what it is. I mean, I want his end of life to be as comfortable as possible.
So yeah, it's just something that's going to take a lot of communication and a lot of rule outs, and and we'll go from there as a step-by-step approach.
Okay, terrific.
Yeah, I think we have a plan. You don't realize that until you have an old dog of your own at home, how frustrating dealing with these old dog issues is. So I understand, because I had one. That's what made me passionate about dealing with these old guys.
Great, that's really great, because I was running out of options. By the time I got to a animal communicator, I was kind of
Yeah, when you do that, you know it's time to do something else.
And he has to be carried this way.
The whole way, yeah.
Yeah.
Carry him like a little football.
Because the pressure down on his tail really hurts it.
Oh, buddy.
There you go, bud.
I'm here. We'll be right back. So I want to thank Monster for coming in and being the first pet featured in our Ask a Vet series. We're going to figure out what's going on with him and maybe shoot you guys some updates going forward. If you have your own questions you want to answer in a month or so, feel free to post your questions in the comments.